Anthony, do you want to go ahead and get us kicked off with our first set of survey headlines?
Sure. So I think from our standpoint, when we actually designed the survey, we wanted to try to get some more key insights around the technology proliferation, how people are using it, and really how it will substantially or impact healthcare on some sort of relative scale. So we asked the question, and we'll kind of go through the numbers here in a minute, of how these survey respondents, whether IT professionals in the hospital or in the ambulatory care system, believe that mobile technology will impact care. So the real key walkaway for us, and I think one of the most compelling points of the survey, is 2/3 of respondents believe that mobile technology will either substantially or dramatically change how care is delivered in the United States. So I think the exact numbers off the top of my head, for the substantial marker is about 52%, Jennifer, if I'm not mistaken. Mm-hmm. And then for those, and we'll cover these numbers here in a second, dramatically impact or change how healthcare is delivered at about 16%. So a total of about 68% of all respondents really believe that these technologies, whether the cell phones, the tablets, the smartphones, or even the applications, are really having an impact of care. We have another question we'll talk about here in a few minutes that really covers to what percent. So we're trying to, I think one of the differentiators or key compelling insights of this survey as well is trying to get an indication of, now that these technologies are actually in hospitals or being used by clinicians, how often are they being used, and what types of things are they using them for. So that was really kind of the key thesis that we were trying to go after outside of just adoption rates. I think the other piece here is that the respondents indicated that mobile technology was most likely to impact care in a few areas. We'll cover those here in a few minutes, but number one was really in the area of pharmacy management. That's medication reminders, trying to get some insights around adherence and compliance. We'll talk about possibly some of the reasons for that going forward. And then really the care continuum. And what we really meant by that is how you're extending care beyond the hospitals. I recently read on actually a plane ride out yesterday that almost 50% of all general practitioners are involved in some sort of accountable care organization to date. That was somewhat staggering when I saw that number. I was actually getting some research down last night, reading on the plane. And then I believe the number is almost 10% of the U.S. population is actually receiving care through an accountable care organization to date. So we're actually starting to see this notion of accountable care organizations taking an impact. And when you look at how you're going to provide more effective and efficient care across a network, I think these technologies in mobile really provide a window into that. So we'll cover these going forward in terms of those real care areas or where they're seeing an impact, whether it's hospital readmissions, problems, care continuum. But I think the key lesson here is in terms of chronic disease management, that these patients are being discharged from these types of institutions, and now these technologies are beginning to take hold and actually providing windows into care and how that care is extended beyond the acute care institution.
All right, well, thanks, Anthony. I wanted to share with you just directly some of the numbers that Anthony already alluded to, and the first area was the impact of technology on patient care. One of the things, as Anthony said, when we were putting this study together, we really wanted to get an understanding on the use of mobile technologies has opened up so many doors in healthcare. I was at a presentation a couple of months ago, and the entire presentation focused on the use of apps in healthcare, and just slide after slide of screenshots of different apps across so many different areas. And it's really interesting to me to see how are people in the provider setting envisioning that, as Anthony said, tablets and mobile phones, you've got 24/7 access to data, and you've got access to data almost anytime, anywhere, and how is that going to change, the traditional means by which healthcare has been delivered? This is the first year that we asked this question. We don't have a baseline from the 2011 study, but we are showing the 2012 data here. And as Anthony said, more than half of respondents, 52%, said, yeah, I can see over time the presence of devices in healthcare and the way that it allows clinicians to access data, that's going to substantially impact the way that patient care is delivered, with another 16% envisioning a dramatic change. I myself am very curious to see how these numbers over the next couple of years are going to play out and change.
I think one other thing to follow up on very quickly, Jennifer, I believe that Vinod Khosla, he's actually a well-recognized venture capitalist and a co-founder of Sun Microsystems. I believe he's at this conference presenting in a plenary session. He's actually gone out on a limb in terms of a projection that he's advocating that 80% of physicians will really not be required in the future of care, whether the group here really believes that or not. It's open for debate, obviously. But that is really kind of putting a stake in the ground, I think, on the far end of the fringe to say that these technologies are proliferating so fast and have the ability to change healthcare so quickly. And I think when you see some of the insights that we have kind of going forward and where they're being used, I think what I'm very excited about is the potential compelling impact that they'll have around not only chronic disease management, we'll cover that going forward here in a minute, but helping to really solve some of these other major issues like hospital readmissions. We know that the Medicare 30-day rule, that is now in place, and hospitals are going to be penalized starting in 2013. So we'll cover that going forward, but this was really the first benchmark we had in trying to get a possible answer around this question.
So let's move into some of the ways that mobile technology can benefit patient care. And as Anthony and I were looking at how we wanted to frame the survey questions, we really looked across 5 different areas. And let me explain a little bit about how this question is developed. We used a scale for this question where we said that 1 is no level of benefit and 7 is a high level of benefit. And so the numbers you're seeing here on the screen represent an average of the level of benefit that our respondents suggested. And you can see here that we tested 5 different areas, and for the most part, the respondents that we talked to feel that mobile technology will benefit care, but at kind of a middling level right now. You know, we're seeing scores in the 3s and the 4s primarily. And so let's talk through some of the areas that we tested. And the first is pharmacy management. And so we're really looking at areas here like medication reconciliation, medication reminders. How can clinicians and patients leverage technology to manage the medication process? And you can see here that received the highest average score at 4.10. As Anthony indicated earlier, care is not only happening inside the 4 walls of the hospital anymore. The majority of care and a great deal of care is happening in other types of organizations, in patients' homes. They're monitoring things in outpatient facilities, lots of different places. So how can mobile technology impact care across the care continuum? And you can see here that respondents gave it an average score of 4.02. And again, with care continuum, we're looking at things like remote patient monitoring or the post-acute readmissions that Anthony referenced earlier. You can see at the bottom end of the spectrum is the pharma research validation. And here we're really looking at things like clinical trials recruitment and the execution of clinical trials. So things that may not necessarily have an immediate direct impact on patient care in a day-to-day basis, but a long-term impact as well.
I think a couple of other insights that I took away from this and trying to get to a better sense of why the numbers shaped up the way they did. One, at least on the second area here, the care continuum, remote patient monitoring, at least in what we face in our business at Qualcomm Life, is really looking at where those disease states are of most interest to hospital systems or even medical device manufacturers. So in talking to some major integrated delivery networks as some of our customers now, where are they focusing their efforts around remote patient monitoring? And if you look at the high-cost areas like congestive heart failure, like COPD, obviously there's a prevalence of interest around those key areas in terms of remote patient monitoring in some of our earliest deployments with major hospital systems, but also on the readmission side and how those impact accordingly. So when you look at pharmacy management, one of the key reasons for, based on the research that we've looked through and I've seen recently, one of the key reasons often why patients are actually being readmitted outside of a specific chronic disease and how that's being tracked and treated is really how they're managing their medications. So whether it's an adverse drug reaction, whether it's they weren't discharged in a proper fashion to understand the medications that they had to take, this is actually another leading cause of why these patients are actually readmitted. So as hospitals get a better grip on how they're handling those readmissions and the 30-day rules and the strategies that they're taking to deal with them, trying to look at simple applications, things like apps that they can download, reaching out, even a service, some sort of a call out to check in and make sure that these patients, especially these high-risk, high-cost patients, often with comorbidities, are actually taking their medications in a proper manner, offers a real opportunity in terms of trying to stem the tide of where those readmissions are coming from. We didn't really see as much here on the resource utilization side. I think one of the other areas that I can see and that we're seeing in our business is the robustness of these solutions. Obviously, these first generations of apps, often that they aren't really curated. There's companies out there like Haptique that does some sort of app curation and tries to rank those. But it's early in the process where we're starting to see these apps develop. I think another thing that we really didn't cover here in the survey is what's the veracity of the data that you're getting. As a clinician, you want to make sure that those data elements are coming in, that they're accurate, that you can get some sort of an insight in terms of how you're actually seeing or caring for these types of patients. So I think you're going to start seeing some of these scores pick up as the solutions get robust, as you kind of start getting into second generations, how they're integrating data, and some sort of element or identity of how that data is being qualified.
Excellent. Why don't you take us right into policy?
Sure. So I'm not going to cover all the numbers here on the slide, but I think one of the things that we had seen versus last year's study is a precipitous increase in terms of those that reported that they actually have a mobile policy in place at their institution. This is 2/3 of the respondents. And this is an increase, we'll cover it here on the slide going forward, a pretty marked increase over last year. So part of the reason for this is obviously is this kind of bring your own device notion that we'll cover a little bit more in terms of physician adoption. We had been using at Qualcomm Life some research that we ran across that 81% of all physicians in the United States surveyed, I think it was a group called Manhattan Associates actually did this, actually have smartphones. And then 62% actually have some sort of mobile or tablet computer. So when you look at the proliferation of these technologies and how they're starting to integrate, often these clinicians or caregivers or even support staff are bringing these types of phones into the hospital, and they're wanting to see, hey, can I actually get my email through these? Can I get some sort of link? Because I'm using this on a day-to-day basis. So we're starting to see that proliferation, and obviously the hospitals have had to respond. Nearly half of the respondents indicated that current and future federal policies were going to impact the decisions that they made with regard to organizational policy around mobile. Obviously, the greatest impact that we called out here is from HIPAA. And then 1/4 of those respondents will implement a policy in the future. So they're obviously keeping a track on how this is being rolled out, how the government and regulatory agencies are actually looking into this as well. I think another thing, I mentioned the smartphone statistic, about 81% of physicians that were surveyed actually have some sort of smartphone. Of those that have smartphones, up to 95% have already started downloading some sort of clinical or medical apps. So you can see the proliferation of this technology. One of the things we always kind of harken back to at Qualcomm Life is that mobile platform is arguably the largest technology platform in history. Worldwide, you're looking at more people have access to this technology than running water, or potable water, electricity, or even a toothbrush. So it's pretty staggering when you look at the amount of connections that are out there. We just launched our business in Europe recently. We noticed that there's over 100% mobile penetration across the continent. So both Jennifer and I were actually laughing. We both have a personal and work phone. So we're two living examples of people that have more than one device here. But some of the numbers that are pretty staggering that I've seen in terms of radio connections per individual, by 2015, there's been some research showing that about over 6 radio connections per individual will actually occur by 2015. So you can look at how people are being connected in a day-to-day world, not only through their cell phones and tablets, but as a footprint of wireless sensors comes down, the costs come down. How does that integrate into everyday technology, whether you wear a shirt that has wireless sensors? How is this going to change how care is delivered? So we're very excited about the potential, but I'll take it right back here to the survey and highlights as well.
Thanks. And so here's just a graphical representation of what Anthony alluded to a few moments ago, where we found that 2/3 of respondents reported that they have a technology in place at their organization this time. And this was one of the really interesting points in the study to me, because there was such a large increase over what we saw just a year ago. And one of the other things that we tested was there are a lot of federal regulations out there, we're going to talk about some of them here in a moment, that are impacting the things that healthcare organizations need to do as they consider rolling out their mobile strategy. And so we tested to see how respondents indicated that these different federal policies would impact their organization. And we found that about half of respondents indicated that as they thought about their mobile technology policy, that they're incorporating the mandates and the other things outlined in federal policy directly into the organization's mobile technology policy. We found that the federal initiatives are also really driving the creation of mobile policies. We had about 15% of individuals indicated that the fact that federal organizations, that the federal government was taking a role and dictating some things, that was really going to force the development of a policy at their organization, and it was really the impetus for the creation of that policy. As Anthony indicated earlier, we asked specifically, we tested several different federal policies to see what impact those policies were having on the mobile technology policy. And the first one, as Anthony mentioned, was HIPAA. And we asked this on a 1 to 7 scale, where 1 is no impact and 7 is a high degree of impact. We found that HIPAA had an impact rated at an average of 4.86%. Meaningful use stage 2, certainly the guidelines have just come out fairly recently, but they're already something that healthcare organizations really have their eye towards, 4.54. Meaningful use stage 1, 4.24, and then organizations are still thinking through how accountable care organizations and patient-centered medical homes are going to impact their organizations, and that had a score of 3.71. You can also see here that the number of organizations that at this point aren't planning to develop a policy is fairly small, about 5%. And I would expect as we go forward and collect data over the next couple of years, I would expect that number is going to shrink. So let's talk about the devices covered in the policy. We wanted to dig a little bit under the covers, not only to understand whether or not organizations have policies, but what kinds of devices and other items are being directly covered in those mobile technology policies. And you can see here that organizations are really including a number of different devices in their policies. The highest, laptops, that's nearly universal. All organizations are covering, or including laptops, governing that under their policy, as well as computer on wheels. The other thing that we did is we certainly recognized that we kind of look at tablets in 2 different ways in this study. We're really looking at those tablet computers designed for healthcare. I think of something like emotion computing, something that's specifically designed for use in healthcare. But, we certainly recognize that, with the proliferation of the iPad and some other devices that might not be designed specifically for healthcare, those certainly do play a role, and clinicians are certainly using those types of devices, and so we covered those here specifically. And so you can see here that organizations are covering multiple types of devices in their technology policies, and the devices, are also widely covered. I want to talk about...
cows and wows.
I'm sorry, computers on wheels, workstations on wheels, so the devices that you can take to the bedside on the device. So the other thing that we wanted to talk about with regard to mobile technology policy is the other items covered in the policy. And we looked at things here like means of securing devices. We're going to talk a little bit later in the presentation about, some concerns that organizations, both IT individuals and clinicians have about, is the data that I'm capturing on a mobile device, if I'm capturing a history and physical on this device, is it secure? And so that's certainly something that organizations are putting some parameters around in their mobile technology policies. How are organizations governing the ability to access data remotely? I'm married to a physician, and I know that he'll check his, his notes or sign off on notes at home at night, and having that secure VPN or, other mechanism to tunnel into the data to make sure that there's secure access. Again, use of personal devices. We found that in our study, only 39% of the people surveyed in our study indicated that the only devices that clinicians can use to access data are those supplied by the organization. So the fact that, again, this is my personal device, and clinicians and other personnel are using those personal devices to access and get patient information, it's something that organizations are really thinking about and, talking about through their mobile technology policies and making sure they're engaging in conversation about. They're also looking at the types of apps, what apps can our clinicians use, what apps are okay for our patients to use to get information. And then lastly, we found that organizations are least likely to indicate that they're going to cover the type of brand of devices covered in the policy. Let's talk a little bit about the future. We saw earlier that 27% of respondents indicated that we don't have a mobile technology policy in place now, but it's something that we're thinking about. And you can see here that the large majority of those respondents that didn't have a technology policy in place at the time of the study said that, within about 6 months, that's something that we're going to be rolling out at our organization. So suggesting that even though they may not have a technology policy in place now, at the time that we captured their data in November and December, this was a thought process. They were already having the conversations at their organizations. So, I would suspect that a number of these individuals have probably already rolled out those policies within their organization. Organizations were much less likely to indicate that they were going to wait a year or two to roll out their policies. So, really paying attention to the fact that they needed to be dealing with their organization now. I also want to point out a couple of different things. We talked about here just a moment ago the devices covered in the current technology policy. We asked the same question for organizations that were planning to showcase data, and so I just wanted to talk briefly about it. 98% of organizations that don't have a policy right now are going to be make sure that smartphones are included in their policy. I don't have these numbers on a slide. I just wanted to show it for emphasis there. Smartphones, laptops, they're really paying attention to these types of devices, making sure that they're included in their mobile technology policies. Pagers, just as in current technology policies, pagers were least likely to be considered. Other items, means of securing data. We talked about that earlier in current policy. It's something clearly, too, that organizations are focusing on in their policies that they're going to be developing. So certainly an issue that they're focusing on, as is the use of personal devices for work purposes. So again, we saw some very similar trends in the current policies and how organizations were planning to roll out their policies. Anthony, do you want to go ahead and move us on to clinician use?
Sure. Thank you, Jennifer. So we tried to get a better idea of not only adoption, but in what percentage of instances is mobile technology used in terms of delivering care. So some of the numbers here were somewhat staggering to me in terms of the 180 respondents that we polled. Physician adoption here was at about 93%. Of organizations already using these technologies, those clinicians, whether they're bringing in their own device or using those supplied to them by the organizations. And non-clinician caregivers at about right about the same level here, at about 89% already using these mobile technologies today to provide some sort of care level. I think we talked a little bit more about the downstream benefit for these technologies and how they're impacting care. There's also an upstream benefit. So, for instance, I have a father who's a radiologist. As the speed of the transfer increases, he's able to read higher quality images from literally anywhere in the world as long as it's on a secure connection. So when you look at how these technologies are actually untethering caregivers, untethering physicians from being able to see the window into their patients, to use dashboards to combine different biometric data readings to get a better sense of their patients without even having to contact them, it's pretty significant in terms of how a physician can use these technologies. And then as we kind of move away from this capitation environment into pay for outcomes, pay for performance, your average physician today, in a lot of cases, especially those general practitioners, are struggling in terms of handling workloads and handling patients. There's been some research, I don't have exact numbers, I'd read this a couple of months ago, but you see a good portion of general practitioners actually wanting to get out of medicine. And a lot of it has to do with operational efficiency. There's just so much coming at them, you can't possibly handle all the different questions and parameters, permutations and combinations of what you're facing on a day-to-day basis. We actually screened a movie called Escape Fire recently at Qualcomm. If people don't know about it, I'd highly recommend it in terms of some of the issues that our U.S. healthcare system is facing, especially the impact on clinicians. So when you look at using these technologies not only to deliver better care, but become more efficient for those supplying care, the actual impact is pretty compelling. 80% of respondents reported that clinicians are using this technology in the provision of patient care. In the slide going forward, we actually tried to get a little bit more granularity around that at terms of what percentage of this type of care or care being provided is actually mobile involved in supporting. And then healthcare organizations obviously are very likely to provide clinician devices to support patient care. So as we saw really a groundswell of the adoption of these types of technologies, whether that nurse or physician or support staff is actually bringing in their own device, that major hospitals or IDNs out there are actually supplying these types of devices, whether it's through a vendor or through some other means, whether a pilot program, for those physicians to use. We're starting to see that take precedence here in terms of providing these types of technologies to those clinicians.
Thanks, Anthony. So let's dive into the numbers a little bit more specifically. And as Anthony just indicated, use of mobile devices by clinicians, either physicians or non-physician clinicians, is extremely widespread. What this graph looks at is out of all 180 respondents we had this year, the percent of all respondents that are using it. If you look at the number, just the number of, so 90% of all organizations reported that at least some type of group, be it physicians, non-clinician physicians, healthcare executives, some group use mobile technologies to facilitate their day-to-day care. And if you look at just those healthcare organizations that said, yes, at my organization we're using mobile devices to facilitate the day-to-day activities, that number goes up to 93% for physicians. So, the use of technology is, prolific and very widespread. I want to point out the other slide that Anthony was just referring to here a minute ago, because we certainly recognize differences in, a clinician can go in and be using devices to support non-clinical activities, but also devices to directly facilitate patient care. And we wanted to get an understanding of the difference in the use of mobile devices specifically to facilitate patient care. And the way that we ask the question is, to what percent of patient care are clinicians at your organization supporting using mobile devices? And if you roll up all the numbers for the physicians, 80% of respondents indicated that at their organization, clinicians are using mobile technology to some extent to provide patient care. Now you can see we've got a lot of physicians grouped down kind of in those bottom numbers. Almost half of them are using mobile devices for, less than 25% of their patient care. So certainly here it's something that while it's widespread and prolific in healthcare organizations, there's still lots of opportunity and lots of room to grow for the use of mobile technology to provide patient care. The numbers are a little bit smaller when it comes to the non-clinician providers, so your nurses, your pharmacists, other types of providers. 3/4 of the non-clinician providers are indicating that they are using mobile technology in some way, shape, or form to provide patient care, and about 1/3 of them indicate that that's less than 25% of all patient care is being provided. So that's something that we're really looking at. Yes?
Just a question about the prior slide. It was a little bit shocking.
Yes.
So if the smallest percentage of use of mobile devices is the patient, how did that improve outcomes? Because I would say 90% of health is what the individual does themselves. Mm-hmm. So what was the mix of those patients? And can you explain at least what you think that low patient number means?
I actually had kind of a different take on it, and Anthony, I'll give you your perspective. We actually are going to be diving a little bit more specifically into some of the patient numbers. Now, keep in mind, we talk to IT professionals, so we aren't talking in this particular study specifically to consumers, to ask how they're using devices and how they're using it to support patient care. We released a study about, in February that talked a little bit about how consumers are using it. I actually was really excited to see an increased number of organizations that were making devices and that were trying to start to engage patients in the use of this care. So to me, that was the take I took on it, is that more organizations are making that available and rolling it out. Anthony?
Yeah, it's funny you asked that. I was thinking about this question the last couple of days because Jennifer alluded to a survey we did earlier this year. We actually went out and talked to not only institutions but to consumers as well. I can't remember the exact numbers off the top of my head, but one of the things that was interesting was the fact that consumers, at least the ones we polled, were very interested in these technologies, but often the physician or the caregivers weren't giving them any indication that they existed. So one of the reasons why we looked, the study was really around barriers to adoption. I think number one issue was really around reimbursement, that those caregivers or physicians, obviously, until they get a clear window into how these things are going to be reimbursed, a certain percentage of them aren't even going to indicate that that's an option. What was interesting from the consumer side is we actually have direct quotes in the study, I believe it's still on the HIMSS website if I'm not mistaken, that they often, consumers and patients, wish that their caregivers would actually give them some indication or information on these technologies. Several of them expressed an interest saying, God, I wish I had known about this. We actually have direct quotes on that. So a lot of this is going to be staged in terms of adoption rates, but also in terms of how that information is getting disseminated. So if you're on the front lines as a primary care physician, this concept of prescribing an app or prescribing some sort of solution, we're still seeing we have a long way to go in that area.
Which is why ultimately it'll be real change will be consumer driven. Because I agree with that quote that you said earlier, which is 80% of doctors will probably go away. Because I agree, if our system isn't working, that's one of the reasons why. So this will be interesting to get that percentage up significantly more over the next few years.
We'll take one question in the back and then we'll. Yep.
I noticed that from 11 to 12, that it's pretty consistent that the usage dropped, except for patient.
I noticed that
Do
too.
you guys have any anecdotal observations on that?
It could partially be just who the survey respondents were, could be part of it. Now keep in mind that, I don't know if I necessarily have a good answer. I mean, I think that, we're talking about 180 respondents, so I mean, it's really meant to generate a conversation around who's using them. I don't know if you have any insight into that one, Anthony.
Yeah, it's a great follow-up question. I haven't delved into the data enough on that, especially last year's comparative data, but it's definitely worth a look.
Was there any geographical
Stratification,
size?
sure.
The sample size was, this year was a little bit larger. Last year we had, I think, 167. This year we have about 180, so. Yeah, and it's not a longitudinal sample. It's not the same, people that we're talking to this year. So it's not that perspective.
Quick question. Are those numbers including laptops? You mentioned that policy. Is that purely mobile devices like tablets, phones?
It's meant to cover a spectrum.
So those laptops.
So let's talk about the organizational provision of mobile devices to clinicians for care delivery. We talked about this a little bit earlier. Our organizations, are allowing the use of personal devices, or they providing devices. And you can see here from this slide that there's a wide range of provision of data or of devices to organization. Again, to get to your question, that healthcare organizations are providing a wide variety of devices to their clinicians to facilitate care, and so it's really fairly widespread. The one thing that I do want to point out here is that we did also ask about the future provision. Our organization is going to be, continuing to roll out devices to their clinicians, and the one area that I found very interesting was specifically in the use of tablet computers. And we found that 51% of organizations who are not using tablet computers not designed for healthcare are going to plan on rolling those out. So we are, I would expect to see some of the use of tablet computers to grow in the future. And half of the respondents that said that they were going to be rolling out tablet computers indicated that they were going to be doing so in the next 6 months. And then I think we have one more slide. So this looks specifically at clinician access to data via apps. We're showing the top 10 here. And we wanted to identify there are lots of different ways that clinicians are accessing data and a number of different types of data that clinicians are getting. And you can see here that viewing patient information is very widespread. It's the most widespread use of apps by clinicians, as is looking up non-personal health information for the respondents. Organizations were much less likely, and respondents were much less likely to indicate that they were going to, that clinicians use the data or use devices to monitor data from medical devices. So this just gives you a snapshot of how they're using apps. I also wanted to make a point here about the types of apps that organizations are leveraging and rolling out in their organization and who's supplying those. And we asked respondents specifically, the apps that you're rolling out to your clinicians, are they things that you're developing internally? Are you leveraging your software vendors to do this, or are you looking for a third party to help you in this area? And what we found was largely that organizations are looking for external solutions. They're either looking for third-party solutions or looking for solutions that are developed by their vendors. There was limited utilization of apps that were developed internally. We also found that about half of respondents indicated that they're either going to launch or develop new apps in the next year.
I think just to follow up very quickly on a point that was asked in the back about comparisons between last year's data and this year's data, I think as we kind of go forward in the app space, the number I think that constantly gets cited is about 40,000 apps out there on the market today that deal with some sort of clinical fitness, wellness applications in terms of what they're trying to provide. Where you may see some differential is in kind of 2011, you saw this initial wave and excitement of these apps. Now as you're starting to use some of these on the front lines, there may be some need is how you're really qualifying this. So I mentioned curation before. How do you actually rank the apps? How do you know if the app is consistent? And then as we go forward, the real need, and we'll talk a little bit more about standardization and some sort of certification. As a caregiver, as a hospital, how do you know in some way, shape, or form that this app essentially could be ranked, that people would actually use it? So as we're starting in the initial wave of this market, there's a lot of excitement going out there, and now we're starting to use a lot of these applications in the front lines, that there's going to be definitely a stratification in terms of those clinicians or those caregivers using certain apps, that they become more robust, that the data is certified, that it's easy to use, that the user interfaces are actually very helpful in terms of care delivery pathways and how they're impacting care. So I don't think some of these numbers are really surprising to us, as we saw those initial numbers a little higher in 2011 and they start coming down because, again, you often only get one chance to impress a clinician. So if your app is not up to snuff, they're probably never coming back to ever use it again, even if you've improved it.
Yes.
What I didn't see here was anything on patient communication. Is that, can you ask questions on that in terms of use of apps or otherwise using mobile devices to communicate with patients?
I know we have some patient questions further in. I think we're going to cover a little bit of that. I'm not sure if that specific question was asked in terms of the patient side. I know we covered communication protocol in terms of understanding, but I don't think specifically, Jennifer, unless I'm mistaken, we asked a specific patient communication question.
All right, and you want to kick us off on some of the more patient-centric stuff?
So we talked a little bit more, and I'm sure this is going to be an ongoing conversation here as the conference progresses here, really around the patient use of these mobile technologies. But we indicated here that more than a third of respondents enable patients and consumers' ability to access information using a mobile device. And then only 13% of those institutions or respondents reported that their organizations are developing apps for consumers. So I think part and parcel, again, this is speculation here, but as we're starting to roll these technologies out, a lot of it is just getting mobile policies in place. And we talked that there's been a market increase from last year. I think it was about 38% of those institutions trying to get their own houses in order, so to speak, and I say that affectionately, before they're actually trying to get a more concerted effort of rolling these efforts out to patients. we'll talk a little bit more going forward about some of the barriers, and one of the ones that was a key takeaway for me. And in our business, we constantly see this issue around security and privacy information. That actually fell to number 2 in some of the distant causes. The highest ranked one, we'll cover that here going forward, is funding. It's actually having funding to provide these types of programs or devices across the hospital system. So from my perspective, a lot of this is looking from the hospital, from the inside out, is rolling these types of technologies out to patients and to consumers. It's a question of, I think, there's a little bit of getting your own house in order first with getting an established mobile policy in place, making sure your day-to-day employees are using that and adhering to that before really putting a lot more effort into actually developing, I'll call the homegrown institutional apps per se. What we're also starting to see a lot more of in the customers that we see a lot in companies talking to Qualcomm Life specifically, it's not necessarily development of that app. It's actually being involved in terms of branding of that app or providing their name behind it. So, you know, whether I'll just randomly choose an institution here, whether it's the Mayo Clinic, whether it's Partners Healthcare, University of Nebraska Health System, doesn't matter to me specifically. But the point is they're going to be looking for ways and how do they differentiate the experience of actually coming to or using that institution, because patients obviously are going to have choices and they're going to be smarter consumers in the future. So what are the opportunities for those hospital systems or those care provider or delivery organizations to differentiate from a branding perspective? So the numbers to me aren't necessarily shocking here, and I'm sure we'll talk a little bit more about some of the other areas that we're seeing as the conference goes on of increased consumer adoption rates.
Well, Nathan, I think you bring up a really good point because, you know, this slide, fairly straightforward. You know, only 13% of organizations indicated that they're developing apps for patients. And I actually would be really curious to understand if we asked this question a little bit differently last year. You know, we just talked about the fact that a lot of organizations are relying on third-party or other vendor apps. So I'm wondering if we, you know, ask this question a little bit differently. You know, a lot of, you know, more organizations may actually be leveraging apps for patients, but they've been developed elsewhere. So there was a little bit of a narrow focus to this question. And then the other thing that we looked at was, is there an app marketplace for providers and consumers? Again, 2012 was the first time that we really asked this, you know, really started diving deeper into questions about specific use of patients and apps for patients. And we found that only about 5% indicated that their organization has created an app marketplace for providers or consumers, and a fairly low number, 11%, are looking at the development of that as well.
I think if I can follow up, Jennifer, one thing that we see in our business on a day-to-day basis is really different market segments. So we're spending a lot of time talking about hospitals. When you look at kind of the fitness and wellness markets, and these aren't necessarily affiliated with any kind of major care delivery organizational system, it's really a lot of those users can pay 100% out of pocket for those applications. So we talked a little bit kind of going forward and even previously about reimbursement as kind of a major stumbling block for a lot of these applications. I think as the market continues to grow, I know that regulatory agencies are obviously keeping a closer eye on a lot of these apps and what their claims are. As those start getting better and up to snuff, you're still seeing a proliferation of apps in the fitness and wellness markets, because essentially in a lot of ways they're not having to deal with a reimbursement issue. A lot of these people obviously can pay 100% out of pocket, and they'll pay full price for those technologies, some sort of monitoring technology. So you're starting to see significant, and you already are seeing significant growth there in a lot of these apps. But when you look at the proliferation, I mentioned that 40,000 number, I can pretty much guarantee off the top of my head that most of those are really affiliated with wellness and fitness, because it's just that consumer market element we talked about before. So it will take some time for the market to respond, but that's where you saw the initial surge kind of going forward. And now I think you're starting to see kind of a step back or a breath of how do you really qualify those applications? Do they work like they claim outside of regulatory agencies looking at those? You also have the users that use these on a day-to-day basis. So this is the first time we've really rolled this out here over the last 12 to 18 months in a lot of these applications, but how are they ranked? How are they used constantly? How are other consumers using these and ranking these accordingly? So we're just starting to see a lot of that take place, and I expect to see some fundamental shifts, especially in the consumer and wellness market here over the next 12 to 18 months, and starting to see some leaders more or less crop up.
Well, let's go ahead and round out our conversation around patient use here. And I just want to revisit this slide very briefly. We talked about, and already highlighted the statistic that at least there's been a small increase here among the organizations that are rolling things out for patients. And so I think this is really an area that as we continue to do this survey over the next couple of years that I am really interested in looking at, because I think this is a number that's certainly going to increase as organizations, continue to pay attention to engaging the patient in their own care.
I think another thing that I'll mention very quickly is when you look at different patient segments or stratifications. I've just seen some research, I believe it was Pew did the study around smartphones. And the number of those individuals in the United States, 65 or older, that are using some sort of smartphone technology seems to be stuck at about 11%. So in just about every other major category, really kind of stratified by age, you're seeing significant growth. And one of the things that we designed our own system called 2Net and kind of this home healthcare hub, there's no configuration required. It's that group of 65 and older that you're not seeing this takeoff of smartphones and those types of technologies. This is the way they've always kind of approached these technologies. Maybe those things will change, but it's a perfect example here where I don't think we're going to see a significant market increase in some of these generations of using these technologies because they're not driven or there's no incentive to do it. If there's other ways to do it where you can have some sort of a plug-and-play application, why do I need a smartphone in terms of dealing with my congestive heart failure or COPD? So we're definitely seeing some very highly opinionated consumers out there across different groups. And I have my father who's over 70, who's trained as a radiologist, and he's still, damn it, I still yell at him for it, but he doesn't use his smartphone. So often he'll only turn it on when he needs to use it. And I said, Dad, what's the purpose of having a damn smartphone if you're not going to communicate with anyone? He goes, I just like to use it when I need it. So I don't think I'm ever going to change his opinion. He probably uses some of the most advanced technologies known to man on a day-to-day basis, but I just don't think I'm ever going to change his opinion on how he uses his smartphone.
Maybe with that group, because my mom is also elderly, she watches a lot of television. So maybe that needs to be the interface for the elderly person, right? Not just elderly person.
Yeah, and you see that too, especially in how they deal with clinicians, is the use of video as a possibility. But there's something to say for the older generations, and the markets will be impressing the flesh. I mean, in a lot of cases, they really want to talk to someone face to face. Even as video speeds, we call it kind of speeds and feeds, increase and improve, it's still not the same. So there's going to be certain segments or stratifications that will want their care delivered a specific way. And there's probably a certain percentage of those that are stubborn enough to say it doesn't matter what the technology is, this is the way they want their care delivered.
There's an app that's been developed that I've heard about that with students that are in grade school, middle school. They can get a free iTunes download if they follow their type 2 diabetes program. And it's phenomenally successful. That's probably not a surprise. It's a real return on investment. We have a project in Montana where we're going to work with Medicare. And we believe it's all about the patients. As you change outcomes, we want an innovation grant. If you want to get the elderly, if you want to get your mom doing it, show her that if she was compliant, she will get some of her copay, like that. Seniors are very frugal.
Yes.
So that's the way to go to the seniors and TV to get over on that thing, and they'll all watch it.
Yep.
But I think that's, you have to go to where your market is, and the market is the patient. It should be 100% patient,
Sure.
maybe 30% doctor.
Well, it's a great point you bring up, and one of the things that we see in our business, especially kind of from a marketing perspective, is it's not just the technology and how exciting it is, but what's the use case? So oftentimes, to your point, we actually have companies that are customers of ours, but also companies we've invested in, that when you have a mother with a type 1 or type 2 diabetic child, to make sure that they understand that these technologies are out there and they are making a significant difference in how you're monitoring your children who may be diabetic or have some other ailment like asthma, that you can keep an eye on them in a school setting or other some sort of setting. So what we're finding is those use cases are resonating with people. So, and for a certain percentage in this room, we may have elderly parents who are thousands of miles away that we need to monitor. So when we actually present those use cases and then the impact of those, it's significantly different than just saying how exciting or how great this app or technology is. And we're starting to see that resonate in the marketplace as well.
We've got about 15 minutes left. I think our last topic today is barriers and benefits. You want to kick us off?
Just going to catch up here. Okay, so in terms of barriers and benefits, I think a lot of the group here is going to be pretty familiar with these. Really around a concern, the first point about the ability to fund the use of mobile technology, that really actually shot up to number one. We'll talk about the numbers here in a moment. Again, we see this time and time again around reporting high levels of concern with regard to the ability to appropriately secure information. We set up our system at Qualcomm Life around highly secure protocols and anonymized data in a secure cloud-based platform. It's encrypted, and we have different payment card industry levels of security. We've had a history of over 20 years handling these secure transactions across several different industries, but it's an ongoing concern. Some sort of mobile policy, especially around security. Does your cell phone have a mandatory password? Because if you lose it and actually have access to those different patient records, now you've got an issue, especially around HIPAA. Really, the greatest benefit here to mobile technology use is improved access to patient information. Jennifer covered that a little bit before. That's really what they're using these technologies for in these early years as their number one use case. But we'll go ahead and move through some of the numbers here. I just want to keep an eye on time.
So as we did the study, we looked at the barriers for using mobile devices, and lack of funding was the top item. And I mean, that wasn't surprising wholly to me. I mean, when we look at a lot of the other research we do, money is certainly a barrier. Having the financial resources to implement what you want, the way that you want to do that. So certainly that was something that was interesting. The other thing that I found interesting as we did this is, as we looked at the barriers, one of the things that we're constantly striving to do as we do this research is certainly we want to be able to trend year over year, but we want to make sure that the survey is growing with the market as well. And so we really added in this year a couple of different items that could be barriers to adoption. And one of the things that we found was the immaturity of vendors. Was something that was identified as a barrier to utilization. And we found that about half of respondents indicated that that is a concern and that is a barrier to implementing technology and mobile devices at their organization. What we didn't find as a barrier, I think, is lack of executive support. It really appears that as organizations are moving forward, there's organizational support to doing this, sort of from the top down, it would appear from these study findings. So, it's really things about lack of funding. Do they have the staff to support it? So those are some of the things that we're seeing here.
I think that the key walk-away for me in this one is that privacy, security, standards, interoperability, those are no longer in the top three. That was kind of a big walk-away for me. It's really around the funding, but also do you have the staff to administer these types of applications, how are you using them for either continuum of care initiatives, hospital readmissions, as well as we talked a little bit about the proliferation of apps. There are just so many coming so fast. How do you know which is the right one? How do you know which is a good one? How are these things ranked? So again, there's so many different companies coming to market. It's this concept of the immaturity of the vendors that are out there. But looking kind of across the whole spectrum of issues here, the privacy, security, standards, and interoperability, those have kind of been watersheds at this conference, especially at HIMSS, the kind of general HIMSS session as well. Those aren't even in the top three at this point anymore.
But let me contrast what you just said, Anthony, with this next slide, because we just talked about the perspective of the IT professionals. Yep. We also asked the IT professionals to talk about what they're hearing from the clinicians who work at their organizations. And here you see that privacy and security of data, top of mind. Now, granted, this is, again, the IT professionals' perceptions of what they're hearing from their clinicians. And privacy and security of data is very important in that audience. So that's something that we are seeing here, as well as things like being able to access data quickly. How quickly can I get to that information that I need using this device or using my tablet? How quickly can I get to the information? It's screen resolution and fidelity. Okay, I've got the information, can I read it? So making sure that the access is good. And I want to talk just behind this slide, we talked about privacy and security, and we have a couple of questions that we asked on privacy and security in this study. We're not highlighting them here, but I wanted to make a couple of quick points. One of the things that we asked specifically is, as you're making devices available to the clinicians and the other folks at your organization, is the data being stored on the devices? And we very largely found by about 85% of respondents that these devices are meant to access data. They're not there to store data. And so that's certainly one way that organizations are making sure that data is secure. We also found that at least 95% of organizations are making sure that they've got security protocols on their devices. 89% of organizations are offering multiple security mechanisms. And we found that password protection and data encryption were most widely used. So I did want to point out some of those points around security. And then I'm going to move on to our last slide here before we get to some concluding remarks. And it's really the benefits to using mobile devices. What is the biggest bang for the buck when it comes here to using mobile devices? And as Anthony said, and as we've been talking about this morning, improved access to patient information. I mean, that's really a clear, that's what healthcare organizations are here for, to promote patient care, and so really enabling that access to patient information and improving access to reference information. So to be able to go into an Epocrates or some sort of reference database is very important. You can see that organizations are at the bottom end of the spectrum. Return on investment or financial impact, that's really not where the biggest benefit is being seen. They're looking at some of those other ROI metrics.
And Jennifer, before we go to the last slide, can I just back up one slide?
Mm-hmm.
Obviously, privacy and security will be a continuing issue. I think one of the kind of insights for me when I looked at this slide and looked through it is now when you look at speed of accessing data, screen resolution, fidelity, and ability to support, this seems to me like more user experience related questions. So as these clinicians, as these hospital systems are using this technology, how long does it take to get the data? Right? Is this kind of fast 3G? Are we getting 4G LTE kind of speeds that we're seeing with some of these screen resolution, fidelity? So I think this kind of predicates, that these technologies are not only being used, but now we're starting to get to the user experience from the clinicians or the caregivers or even support staff on the front lines. Now I'm starting to use this. Is it a robust application? Do I get what I need, when I need it in terms of treating a patient? It's almost like the 5 rights of mobile technology here. Maybe that's the question to be asked, especially around user experience. So I thought that was a key indicator before we kind of finish up in terms of these types of applications are being accepted in the marketplace, and now they're starting to ask the user experience types of questions affiliated with them.
Why don't we go ahead and offer
Sure.
concluding remarks?
So as I said, the real compelling kind of key statement was really what we started with, that 2/3 of respondents said that these mobile technologies will either substantially or dramatically impact the way care is delivered in the very near future. I think that was kind of, when I saw that the first time, and I'm glad we asked the question and tried to get into a deeper insight into what those, especially high acute care institutions were thinking around this technology. It was extremely promising in terms of not only the rollout, but the impact that these types of technologies can have in delivering care. And organizations will continue to develop and enhance their mobile technology solutions, use of apps not only for clinicians and staff, but to support patient access. Indeed, we run into customers now, and there's a couple of organizations, I can't mention names for confidentiality reasons, but we have some of the leading medical organizations out there looking at how do they potentially brand apps. And these are very highly regarded organizations across different care segments in terms of how are they going to play in this market. Do they certify an app? Do they just brand it? So we see these discussions going on today with some of our partners out there in terms of how do they make their presence felt in this market. I think the other thing that you're starting to see, especially when you look at overall internet use versus app use and how the market's starting to change, is that once that you're using an app, and you're starting to see this in the way Google conducts its business, in terms of if you've got a situation where I'm in that app on a day-to-day basis, why do I need to go out of that app if it has search capabilities to go onto Google, to go onto other search engines? So when you look at how these apps are integrating information, how these apps can be branded, there's not only user experience, but there's also an element of how the market's going to change in the future. Why do I need to go outside of how that app is interfacing me with my patient on a day-to-day basis? If it's effective and I've got everything I need, these are really kind of not only key differentiators, but it's also offering windows or insights into how the market's changing. So I think we're very optimistic in terms of, these technologies are rolling out. We talked about mobile as being one of the largest technology platforms in history. And it's not only here in developed nations like the U.S. and then Europe. I think in North America and Europe there's about 300 million people with at least one chronic disease. Worldwide it's about 860 million people with one chronic disease, and that's actually consuming over 3/4 of all medical spending here in the United States. It's actually in some of these developing nations as well. And kind of a shocker for me was that I came up through the infectious disease ranks, that chronic disease is now the #1 killer in developing nations as well, not just developed nations. So when you look at the use of this technology, not only here in major healthcare systems, potentially here in North America, maybe we open up a survey to Europe in the future, but how this can impact care going forward, even on a consumer basis, I think the opportunities are very promising.
Great. Are there any other questions? Yes.
In terms of the actual technology, and I don't know if you're asking this or not, but are you seeing exclusively cellular and Wi-Fi connected devices? Or are you seeing other types of devices?
We did not specifically survey for that in this particular conversation. I don't know if you have some anecdotal comments that you care to offer.
Yeah, I've seen in this survey we didn't. I've seen some other work, and if you want to give me your card, I can probably share that with you about hospitals' policies around wide area and access WANs, et cetera, wireless, and then cellular. It's a great question, especially these devices that, having cellular connectivity outside of working through the wireless network is important, but nothing specific to this survey, no.
Other questions?
Question in the back?
Go back to the previous slide.
Any question around that, or you just wanted to gaze at it a while?
Yeah, I just wanted to see the numbers.
Okay.
And as I said, the report is available on the mHIMSS website. It does have a full complement of slides in it as well.
One of the biggest barriers that I can see in improving access to patient data is these networks being really concentrated in hospitals or around networks of hospitals and outpatient services. Do you see that getting any better? Where if a patient's data is generated in one set of technology to cross-access, do you see that improving at all with this technology?
I think what you're saying is the availability of data from one database across different types of institutions. Is that? Well, and I think that part of it is access through health information exchanges and accountable care organizations. And so I think that as the industry moves forward, I think those are the types of things that are going to help facilitate access of better information across different types. I mean, I think that also healthcare organizations are they're working with physicians in different ways. I know some healthcare organizations that I've talked to are working with acquiring some of the physicians' organizations so that they can have better control of interfacing the technology directly.
I think at least from what I've seen anecdotally, you're starting to see, as the Affordable Care Act has now been passed, and a lot of these initiatives were already moving forward irrespective of what happened in terms of that decision rolling out. The maturity around these health information exchanges, I just read something on a plane ride here yesterday that a couple of them are actually moving very quickly to profitability. So as you're able to kind of sustain those organizations going forward to roll out different applications and functionality around dealing with these different technology types, you're starting to see some windows of opportunity there. So I think one of the things, at least from our perspective, and I mentioned ACOs and this kind of network of care, that it's technologies like mobile that are actually providing kind of the network or the glue in terms of connecting, and not only connecting the types of data, but connecting the patients to the caregivers as well, not only inside the hospital, but outside as well. So we're starting to your specific question, I think I've seen some advances, but I don't think it's anything that's pretty significant so far at this point.
Well, that's my experience that I live in Philadelphia, I live in 13 hospitals, and there is really no advancement in this direction that I can see. You know, a place where there's advancing would be interesting.
Yeah, I'm happy to share my card, and feel free to exchange information as well.
Any other questions this morning?
Do you want to take them the last slide, in case there's the...
Oops, sorry, wrong way. Just our contact information is on there, so you're welcome to take that down and reach out to either one of us. It was a pleasure to be able to have the opportunity to share this data with you this morning. Our contact information is there. If you have any questions, let us know. As I said, the study is also available online for you to download.
Excellent.
Thank you.
Have a great rest of the conference, everyone.